Let's move on to the next condition, hordeolum, or more commonly known as the sty. Okay. Now here, there are two types. You can either have external, number one, bottom left, okay, external, Zias, gland of Zias. Internal will be your meibomian gland. And here, or if it's a chronic inflammation, is it going to be painful? What do you think? Painful. Chronic condition. Granulomatous? No. Okay. But if it's hordeolum or a sty, it's a suppuration. It is an infection. It's going to be acute. It's going to be sudden. It'll be quick in nature. And it's going to be painful. Key. Please keep that in mind. Chronic. No pain. Acute. Yes. Infection. Hordeolum. Sty. All the same. Internal, external. The way that I like for you to remember is X, Z. Okay. The type of gland that the external will affect is the gland of Zias. The internal will be your meibomian gland. Okay. Now here, once again, a case scenario. 68-year-old female complains of a 3-day history of a red tender nodule in her left eyelid. She has had numerous nodules in this same area over the last 5 years that have partially resolved spontaneously, though she has been able to palpate a residual bump in her eyelid. Aside from her painful eyelid, she has no medical problems and has been in good health. Examination of the left lower eyelid reveals a tender, discrete nodule with minimal conjunctival injection. A small amount of pus can be expressed, and the nodule is extremely tender and seems to involve a hair follicle. There is no loss of pupil reflexes, and visual acuity remains intact. What is the most likely causative agent? Any takers? Can you guys predict as to what this is going to be? Yeah, exactly. I heard Staph aureus. It's bacterial. That's something that you want to keep in mind. It is going to be bacterial. You see pus. It's painful. If this was chalazion, would this be painful? Absolutely not. It is a reaction to what? Chalazion? Lipid, exactly. This is an infection. This is a sty. Moving on. Xanthosoma. You've heard of xanthomas, right? Xanthomas, they're tumors, right? Lipid tumors. But this is xanthosoma. Xanth, lipid, lesma, flat. Okay. And basically what you're looking at here is foamy macrophages. You have macrophages that are filled with cholesterol. It appears as, so this particular individual probably has, what do you think, normal cholesterol levels? Yes, absolutely. All right, now here's a little algorithm. Patient with swollen red eyelid. If it's bilateral, everything in red is no. Green is yes. If it's yes and it's bilateral, you're looking at blepharitis. That's the only thing that I'd really like you to take a look at. Whereas if you follow it down on your right, then you basically go down to the pain. Okay, and we covered this enough, right? So if it's pain, it's hordeolum, and if there's no pain, then it's chalazion. So, all right, this you've covered. An endocrine, the orbit. I'm not going to spend too much time here. You've seen Graves' ophthalmopathy. Okay, I'm not going to cover it. However, and this will not be tested as far as I'm concerned. Conjunctiva. Now here is where you guys need to pay attention. The inner aspect of the eyelid, what type of conjunctiva is that? The inner aspect of the eyelid, is it palpebral or is it bulbar? No, the inner aspect of the eyelid. Palpebral, yes. The superficial part of the conjunctiva, or I'm sorry, the sclera, is the bulbar, right? Shaped like a bulb. We will talk about infectious, viral, bacterial, allergic. Now, before I even go on, take a look at the key words. As far as viral, bacterial, and allergic, because those are the ones that will get messy. The infectious will be rather obvious. It'll be in the case scenario. You'll figure that one out. You just have to figure out which causative agent. However, viral is going to be watery and clear. It's preceded by some type of viral syndrome, prodrome. Bacterial you're going to see viscous, a white type of pus, okay? Copulent, quite a bit of white pus, and that's going to be bacterial. And then allergic, that's going to be an individual who has seasonal allergies or whatnot. All of these will end up having injection, conjunctival injection. Okay, but what you have to do is figure out as to what type of secretions they're having. Are they having watery? Are they having viscous? All right, so pay attention as to what's going on with the stem. It'll tell you everything that you need to know. All right, so let's hit infectious. We talked about bulbar and palpebral. And here, a quick little summary, but I like this one a lot. Here's a tear film. Who makes the oil part of the tear? What gland is that? Good. And if you have obstruction of it and it is chronic, reaction to lipid, chalazion. Okay. Now, to make it easier, trachoma. These infections are so sad. A, B, and C. Have to know that A, B, and C is trachoma. Absolute blindness. 4 C's. Chlamydial, chronic, contagious, conjunctivitis. How is it spread? The F's. Finger. What are fomites? Yeah, inanimate objects, such as when you walk in a gym and you're sharing your best friend's towel. You know you don't like them very much. Cause you a lot of heartache. But point being is A, B, and C. Please know this. That's the 4 C's. This is all trachoma. And what is it going to affect? The conjunctiva. Here's a little table. We'll talk about inclusion conjunctivitis in a second, but at this point we're still talking about trachoma. What are the strains? A, B, and C. Yeah. All right, if we review the life cycle of chlamydia trachomatis, all right, remember the elementary body? Elementary body is the one that's infectious. The reticulate body is reproductive. So once the elementary body enters the cell, what cell? The conjunctival epithelial cell. It is a conjunctiva. That's what I'm trying to say. You have to know where you are. It's affecting the conjunctiva. So you have a chlamydial trachomatis. If it's trachoma, it's A, B, and C. You have elementary body, which is the one that's infecting, and then it's the reproductive body, or the RB, reticulate body, which is reproducing within the cell. All right, once again, everything's highlighted for you. There's a conjunctival epithelial cell, a cytoplasm filled with your little organism, a little bugger. Leber cell, named after Theodor von Leber, large cellular debris-laden macrophage. We're still on chlamydia trachomatis. You see Leber cells. And I have highlighted the L because that's what a Leber cell is. It's large cellular debris-laden macrophages. Okay? They're filled with cells that have been absolutely destroyed. All right, now, this is important. Well, there isn't much that isn't, so. Virtue always bilateral. We're still doing chlamydia trachomatis, strain A, B, and C, trachoma. And what I'd like for you to pay attention to is here is the upper half. The upper half of the conjunctiva is more commonly affected than the lower half. So that would mean that here, these follicles are filled with lymph cells, lymphocytes. Okay, and that's what you need to remember. So when you take a look at your upper tarsal or your upper conjunctiva, okay, you'll see these follicles. Eventually, follow the conjunctiva through. The bulbar conjunctiva, what is that connected to? Right in the middle, we have the cornea. And as any infection, it will spread. Where is it going to spread to? It's going to spread to the cornea. If it's going to spread to the cornea, and you have an infection, you have increased blood vessels, it just gets very, very messy. Okay, and that is developmental process of a penis. as far as chlamydia is concerned, trachoma. You see pannus elsewhere, and the mechanism can be quite different. But as far as trachoma is concerned, you have the conjunctiva initially. What type of cells? If the macrophages come in, what are they known as? Leber cells. As the infection grows and affects the cornea, then this is a pannus formation. So that is a trachomatis. See how hazy the cornea is? More pictures of trachoma, a normal conjunctiva. Remember, I said the upper half. Upper half. And then if you take a look at your top right, you can see the follicles. What do they contain? Lymphocytes. And then eventually it gets scarred, right? Just like anything else. And then trachomatis trichiasis. What does that mean? Anyone? Trichiasis? It's basically when your eyelashes are coming in, they're retracted inwards because of infection, because of scarring, right? It's contracting. So that's trichiasis. Corneal opacity. What's another name for that? Pannus. Thank you. All right, so that was A, B, and C. D through K. Inclusion blenneria. Think of this as being a baby. Passes through the vaginal canal, and this is how the baby, the newborn, is going to conceive chlamydia. This is D through K. This is inclusion blenneria. So we're done with A, B, and C. That was trachoma. Okay. This is D through K. Inclusion blenneria, vaginal canal, non-chlorinated swimming pools. Inclusion conjunctivitis. Pretty much the same. Pretty much the same as A, B, and C. However, one major difference. Well, two major differences. Number one, it's chlamydia trachomatis, but it's D through K, number one. And number two, you have the lower conjunctiva, which is being affected. That's inclusion conjunctivitis. Lower tarsal conjunctiva is involved. The scarring doesn't take place, so you don't have much of that trichiasis. Okay? Classic ophthalmio neonatum. This is Neisseria gonorrhea. Okay, so we did chlamydia trachomatis, A, B, and C, D through K. This is Neisseria gonorrhea. The only thing that I will hold you responsible for is ophthalmia neonatum. Okay, here. Twinsboro college student comes to student health clinic complaining of burning, itching, ready eyes. So remember, this is conjunctivitis. We have different types. You have infectious, name me another type. Allergic, bacterial, and viral. All right, so I will cover the other conjunctivitis through questions. It just makes it easier. It just makes it that much more relevant. A 23-year-old student comes to a student health clinic complaining of burning, itchy, ready eyes. Does that tell you much? It's conjunctivitis. Big whoop. Approximately 3 days ago, he noticed that one of his eyes appeared pink. Since then, his other eye also has become involved. He has noticed morning crusting of his eyelids and a water discharge throughout the day. A review of symptoms reveals additional complaints of low-grade fever, malaise, diffuse myalgia, and a sore throat lasting approximately a day. He is concerned, as he had pink eye as a child, and is worried about spreading an eye infection. He's hoping you will prescribe an appropriate antibiotic, and he does not want to infect friends and family. Examination of the eye reveals bilateral injected conjunctiva, profuse amounts of tearing with scant amount of thin mucoid discharge in the center corner of the eye. Examination of tarsal conjunctiva reveals a bumpy appearance, epithelium by gross examination. What do you think so far? Viral. Why do you say viral? Yeah, you have the prodrome viral syndrome. Okay. So that's how the question will pretty much present. Okay. And what's important there? Well, first of all, the fact that this patient has a viral infection. But how do you know that? Viral symptoms. Low-grade fever, right? Malaise, diffuse myalgia, sore throat lasting approximately a day. Okay. And then what about the secretions? What do they look like? Well, we have bilateral injected conjunctiva, profuse amount of tearing, but what kind of tearing is that? Is it viscous? No, it's watery. Okay, well, let's go on to